Welcome everyone to Sacramento. For those of you who aren't from Sacramento, it's a pleasure for me to be here, get to see you all face to face, and I think for you who've been monitoring the webinars, it's an opportunity for you to see some of the bodies that go with those disembodied voices that you've been listening to over the course of the last few months. We're here in California. And nationally, and the nation as a whole, are in the dawning of an extraordinarily wonderful moment in the healthcare industry. I can't think of a time when there was more innovation, more creativity, more excitement, and more investment going on in healthcare than what we're seeing right now. It's a moment of great creativity. It's a moment of great opportunity. And it's a moment when we together, over the course of the next few years, are going to be shaping the foundation for the healthcare delivery system that's going to be here over the next 20, 30, 40, 50 years. Our responsibility to do that carefully and sensibly and efficiently and wisely is profound, and we will be shaping the future of healthcare delivery in California, and if not the nation, through the example that we set here in California. So we have a great challenge ahead of us, but great opportunity. California's always been a leader in technology, and I think the nation expects us to be able to set the pace, set the tone, and set the vision for what can happen in the use of technology within the context of the healthcare delivery system. And I think the HIE movement in California offers the opportunity for us to do that. Some other states, I sometimes think it'd be really nice to be in a state like Connecticut or Rhode Island, where I could take it and put it in my back pocket and go home and not have to worry about all of the things that we have to worry about every day here in California. I think of the diversity and is anybody here from the East Desert? We got folks here from Modoc County or for up north. Yeah. We have a very diverse state. I had the opportunity when I was child support director to travel and visit an awful lot of the rural California. Coming from rural Indiana, where I grew up, it made me feel at home, but it also drives home the issue of the great distances, the great diversity, and the great complexity of the state that we have to deal with. I've talked about the HIE development in California as being like building the Bay Bridge. We're building it from, well, I guess it's not even just two sides. It's almost from four sides all at once. And we have to build it in a way that simultaneously, and with the hope that it all fits together when we finally get to the end. We have a lot of great infrastructure in place and a lot of parts of California that we want to build on and take advantage of. But we have to make sure that that's relevant to the work that we do as we build forward. Now, I'd like to take a moment and step back and talk about the overall context. As many of you know, you may have heard that we're having some budget problems in Sacramento. Our state budget is significantly underfunded because of the slowdown in the economy, and it's expected to be that way because of the slow, unexpectedly deep recession and this long period of time that's necessary to get back to our usual level of revenue. That means we've had over the last couple of years to make some very, very difficult choices. The governor has made efforts to try to get those choices to include some increases in revenue to balance off some of the cuts, and he'll continue to do that. But whatever we're going to do, I think the governor's committed to making sure that budget that's put in place is on a sound footing. That included this last year some reductions that in the context of trigger reductions, which are on the table and will need to be faced in this coming January. They are part of an overall plan to make sure that California is living within its means and is able to plan sensibly for the future. We've also been working a lot on restructuring government, particularly restructuring the relationship between state and local government. That's an important context because I think that there are great opportunities to get better solutions to problems and get better services to our constituents by reorganizing and re-rationalizing the relationship and the division of labor between state and local government. So it's an important opportunity to get better productivity out of the public sector by doing that kind of reorganization. We also are going to have to continue to monitor the budget. This next year we'll probably continue to have shortfalls that we're going to have to deal with. And so I can't tell you exactly what kind of choices we're going to be facing in that arena. But I would like to say that in spite of those difficulties and those things, and I very often when we talk about the great things that are happening in healthcare and the Affordable Care Act, people complain about the elephant in the room and our budget difficulties. It's important for us to talk about them, to recognize them, but it's also important for us to get behind solutions that are really sound and solid and balanced so that as we go forward, we don't have to continue to face the tough choices that we've had to face. So let's turn to the positive side. In the healthcare arena, we have tremendous investments, largely due to the actions in the federal government and the Affordable Care Act, and before that, in ARA. Tremendous investments in how we're going to deliver healthcare, how we're going to reinvent healthcare, and how we're going to expand healthcare throughout the population. I think from California's point of view, from my boss, Secretary Dooley's point of view, in addition to expanding coverage, we want to make sure that we make the right changes in the delivery system so that we can provide care more efficiently, more effectively, and with a better quality. And we also want to do things that are going to allow an individual to take better control over their own health care and their own health status, and to be able to take actions to mitigate conditions they have and to prevent conditions as well. There's a lot of work going on in expanding coverage. Right now we're expanding the low-income health program to provide coverage for childless adults throughout the state. And as you know, we're building the health benefit exchange and working on expanding eligibility in Medi-Cal. So in 2014, we'll be able to enroll a significant number of new individuals for coverage. That expansion in coverage for these programs is going to put great strains on our healthcare delivery system, which many of you, I'm sure, are direct participants in. We have to figure out how we're going to deliver more services to more people in the context of broader coverage, and that's where where the keys to our efficiency come in, and that's where the investments in health information exchange are going to make all the difference. But we're also doing some other things. We're enrolling our seniors and persons with disabilities in the Medicaid program in managed care structures, which do a more effective job of delivering care. We're also going to be launching experiments in getting better integration of long-term care services and coordination of coverage for the dual eligible population in the Medicaid program. About 1 million individuals where I think there's great opportunities to get better outcomes, better efficiency, better productivity out of the healthcare system. So where does HIE fit into all of this? It's a key element to the efforts to improve the productivity of that healthcare delivery system. Many of our largest institutions in California have been making investments in HIE for many years. But now we're at the point where we're offering incentives and investments to individual providers throughout the state and individual hospitals to make sure that they make the kinds of investments in providing automated medical records that will be able to provide the foundation for the source of the data that will be necessary to provide the ability to exchange data effectively throughout the state. I can give you a couple examples, and they happen to be the two examples that we've chosen to be the particular targets of effort for in the context of our HIE grant. We are planning to work in a couple of targeted areas where we hope to make significant progress in helping people with conditions where in particular classes of populations where they have complex needs and where coordination of care is very important. We're calling them breakthrough goals. We've been identified them with the feds in areas where we want to concentrate our effort. One area is in the treatment of foster care children. Foster care children very often have very significant and high levels of medical care or mental health or behavioral health needs. Very often foster care children will move from county to county without necessarily dragging their medical record from one place to the other. And very often foster care children will be needing emergency care in a situation where the person who is taking them to that emergency care doesn't necessarily know their health history and know the details of what conditions they have and what history they particularly have. So it's an opportunity where, and it's been recognized for many years, that it's an opportunity where if you had a bit more unified health record that was easily accessible by a practitioner who might be called upon to treat a child in foster care, that you could provide better care, better coordinated care, and get better health outcomes for that child. Another area where the state's long been struggling for better coordination is the area in long-term care integration. We have individuals at home, in institutions, trying to make transitions from one to the other. And we have not, we've been searching over many, many years for the appropriate way to get a more integrated long-term care setting, long-term care delivery system. Our pilots and the dual eligibles will provide opportunities for experimenting in that arena, but also important is to have a more integrated place to go for information about the delivery, the individual's medical record, so that the variety of providers who might be engaged in delivering care for a person who needs care in the long term will have access to the information that they need. These particular target areas, I think, it's great to identify some concrete focused populations where the principles of HIE show promise, and we can actually demonstrate how the delivery of HIE in that particular context provides real value. And it will be a demonstration for us to be able to see how that can then apply to other populations as well. The work that we're doing together requires tremendous level of coordination and communication and networking. I'm glad you're all here today because I hope you'll learn about each other, learn each other's experiences, and be able to establish the context and the contacts that will be necessary for us to move together as a state down this very, very complicated road. It's going to take a lot of coordination effort, and I look forward to the excitement of doing the creative work that's going to mean a new foundation for the future. We have a tremendous opportunity in California to really define not only for ourselves but for the nation how healthcare will be shaped, and we have with the resources in this arena and in the coverage arena to be able to make great steps forward. I'm very optimistic that we're going to get good things out of this. My boss, Diana Dooley, was sorry not to be able to be here today. She's in Washington. You may have heard some of the discussions they're having in Washington about resources. Some of those things get a little bit scary, and I'm glad she's there trying to understand what's going on there and to make the case clearly what California's needs are. But we're going to be working hard to make sure that we get the best use out of the resources that we have in the context of HIE, get the best coordination out of the investments we're going to have here so we'll be able to build a system that really works for us. I'd like to now turn over the mic to Dr. Lynette Scott, who is from the Department of Public Health, but has been our interim Deputy Secretary for HIE. Before she comes up, I want to say I've been working with Lynette over the last few months since January when I took over as Undersecretary. It has been an extreme pleasure. For you, those of you who don't know her, I hope you may take the opportunity over the course of the day to try to buttonhole her and take some time to talk with her. She is a gracious, wonderful person, and she is highly skilled in dealing with the communication complexities that HIE demands, and we are very, very lucky to have her with us today.